Here is your question. Right, so if you have read and understood, considering it history taking station, kindly begin.
Hello, good morning. I'm Dr. Moon, one of the doctors here. Can I confirm your name and age, please?
Yes, I'm Rebecca, 53-year-old.
Rebecca, 53. Hi, Rebecca. Nice to meet you here today. How are you feeling, Rebecca?
Doctor, I'm having a severe pain in my head. Oh, doctor, it's a severe pain.
Oh, I'm so sorry to hear that, Rebecca. So, are you in pain at the moment? Do you need any painkillers?
Yes, that would be great. Yeah.
Okay, so yeah, I'll give you some painkillers. Okay, Rebecca, can I proceed with a few questions about your headache? Could you please tell me a bit more about that if you are comfortable with that?
Yes, doctor, yes.
So how it started and what's the character?
Doctor, it started this morning only. And before that, I had a episode of I got unconscious. I was cooking in my kitchen. I got unconscious, and after that, when I gained my conscious level, and this headache started, and it is very severe, doctor. It's in back of my head, doctor.
Oh, I'm so sorry to hear that. That must be really hard, difficult for you to deal with this pain. So, Rebecca, is this your first time having a headache like this?
Yes, it's why I used to have headache before, but it's the worst headache ever I have experienced, doctor.
Right. I'm so sorry. What's the character of the pain? Is it aching, stabbing?
Yeah, it's stabbing. Yeah, you can say it's a stabbing. Yeah.
Does it move to any part of your body or any other part of your head?
No, it's no.
Right. So it is the headache since that time, has it been there all the time or does it come and go?
It's present all the time, doctor. It's all the time.
Right. And is there anything that makes you feel better or worse?
No, nothing is making me feel. Yeah.
Well, when you cough or when you go to the loo, is it worse?
No.
Okay. And then how would you rate severity on a scale of 0 to 10, 10 being the worst?
It's a 8, doctor.
Right. Okay. Well, apart from this headache, do you also have any problem with such as seizure?
No, I never had a seizure. No.
And then do you also have any problem with vision?
Not really, but I can feel there is some increased sensitivity to the light, to my eyes.
Right.
I can't even open my eyes properly. Can't see
Oh,
towards
I
the lights.
see. So would that be okay? Would it be better for you if I dim the light right now?
Yes, that would be
Okay,
great.
yeah, I'll dim the light for you. And do you have any neck stiffness?
No neck stiffness.
High temperature?
No.
And did you vomit?
No.
Right. Do you have any weakness in your legs or arms or any sensation changes?
No, doctor.
Right. Okay. Do you also have you noticed any intentional weight loss these days?
Sorry?
Have you noticed an intentional weight loss these days?
Yes, I have lost, but not really. I mean, 1 kilogram in 1 month. Not really, not much.
Okay. How about your appetite? Are you eating and drinking well?
Yeah, it's fine.
Great. And then, have you got any injury before this happened?
Injury, no injury, no.
Right. Are you diagnosed with any medical diseases such as hypertension or any kidney disease?
Yes, I was diagnosed with adult polycystic kidney disease. Yes, and I got operation for that. And years back.
Right. Okay. When did you got diagnosed with that?
When I was 30 years old.
Okay. In your family, is there any family member or relatives who has a history of brain diseases or like that?
Yeah, one of my aunt died because of some brain hemorrhage, I guess. So yeah.
Oh, I'm so sorry to hear about your aunt. All right. And so, have you undergone any surgeries before?
Yes, for my kidney surgery. Yeah, I told you before that.
Okay, yeah. So no more any other surgery. So, are you on any regular medications?
No regular medication.
Okay. Any drug allergy?
No, doctor, not regular.
So, what do you think you are here for?
I don't know. My aunt was having similar problems before she had bleeding in her brain. I'm just worried even I'm having the same problem.
Well, I'm really sorry about your aunt, and actually, for the time being, it's really hard to say to tell diagnosis. We need a bit more information by history taking. Yeah. So, if I would have time permits, I would ask concern expectation and smoking history, drug history, and occupation history. And so I took a history for this 53-year-old lady who came to the clinic with sudden onset of headache in the occipital region, which is stabbing in corridor and continuous, which seems to be the worst headache of her life, with a severity of 8 out of 10. There is no accessibility or related factor. No features of raised intracranial pressure such as vomiting and seizure, but there is increased sensitivity to light. No signs and symptoms of infection or constitutional symptoms such as loss of weight or loss of appetite. So my provisional diagnosis, and she had a history of polycystic kidney disease diagnosed with 30 when she was 30 years. I got a surgery for that. So my provisional diagnosis is a subarachnoid hemorrhage. Headache due to subarachnoid hemorrhage, but I will also consider other severe occupied lesions such as abscess or other infections such as meningitis and encephalitis or malignancy, either primary or secondary.
Okay, how do you plan to manage this patient?
For this patient, I will do routine blood investigations such as full blood count using liver function test, and then I will next, I will do CT head to look for any signs of hemorrhage or infarction. And then, since if this is a subarachnoid hemorrhage, this is a surgical emergency, I will liaise with the surgical neurosurgeon and also report intense ITU registrar. Other physiotherapists, other specialist nurses will also be involved. For the patient having very severe pain, I will give her painkillers and I'll give her nimodipine to reduce vasospasm. Yeah, for the deflated management plan, I will it will be a surgical management plan with surgical endovascular coiling or clipping. If there's features of ICP, I'll do bar hole or craniotomy.
Okay, good. Thank you. Thank you.
Thank you.